So the first thing that I'm going to do is I'm going to start with my goat hair brush. This is a brush from Brasseler. And I can tell you that this brush, along with the muslin wheel, are a great polishing technique with the two. I like to use both, but I will tell you that when I remove my Super Snap and I place the polisher into my handpiece, you know, this one I'm actually going to push it a little bit further and I'm going to lock it in. It's going to be a palm thumb grasp, not a pin, okay, because I don't have control, right? Palm thumb grasp, but you don't want to turn this up really high. And the reason being, you can hear that, but if I turn it up really high, you can actually burn your provisional. And ask me how I know, because I've done that, right? So I'm going to turn it down, but I want to turn it a little bit higher than I did with my sandpaper disc and with my Safe Side diamond disc, because I do want to make sure that it's a little bit higher. Now, holding that provisional, okay, you see how it's really just moving, 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 moving. Think about the lathe. If you were going to use that pumice, you know, now this is not the high shine. You may already notice that, right? But what I'm doing is I'm removing any of those little particles from the sandpaper disc that I might have nicked the provisional with. That's the purpose of the goat hair brush, okay? Palm thumb grasp. You see how I'm holding it? I'm really getting in there with this brush. See it? You see? And again, imagining yourself, if you were in your practice, in your lab, using a lathe, I want to make sure that I get in every little nook and cranny. Again, also in the interproximal area, because guess what? Patients will complain that that's not smooth. Getting in that area. The other thing is it needs to be nice and smooth in the proximal area so you don't trap food, you don't trap plaque. And that's the last thing we want again with that home care, right? See how I'm just kind of smoothing that off? Okay? Getting into that interproximal area there. Making sure the lingual is just as smooth. I've had a lot of assistants will say, well, Shannon, you know what? I don't have to worry about the lingual quite as much. But think about this. What's on the lingual? Where's the patient going to probably touch those provisionals the most is with their tongue, right? So we want it to be nice and smooth. Okay, that's looking really good. Going to come right here. Okay, that looks really good.